Welcome. My name is Peter Strong. I'm a professional psychotherapist specializing in mindfulness therapy, and I offer therapy sessions via Skype for overcoming anxiety and depression using mindfulness therapy. So, first of all, is Skype therapy effective? Yes, the answer is most definitely it is effective. And more effective than other forms of online therapy, such as email counseling or using a chat format, because you can see each other. So Skype allows you to see each other, and that's a tremendous advantage over these other forms of online therapy. And from my experience doing both, there's no difference in effectiveness between therapy delivered via Skype when compared to psychotherapy in person with a therapist. There's really no difference as long as you can see each other. So the other advantage of Skype therapy is that it allows you to have your sessions from home or from work or from a place where you feel more comfortable. And this is really important. It means that the quality of your therapy sessions will be better because you are in a much more comfortable place. And that's something that is very, very important. You need to feel in control of your therapy sessions. You need to feel that you are taking the lead rather than going to a traditional psychotherapist for some form of treatment or evaluation. That approach tends to leave you feeling more like a victim, and that will not help the therapy process. So online therapy typically eliminates this barrier and allows you to feel more comfortable and more in control of your therapy process. So I teach mindfulness therapy, and I find this to be extremely effective when delivered via Skype, and it's very, very effective for overcoming anxiety and depression, and for working with addictions as well. The main focus in mindfulness-based therapy is on teaching you how to fundamentally change the relationship that you have with your emotions. This is so, so important. Most people fall into a habit of becoming identified with their emotions, the painful ones that get activated when the conditions are right. We tend to become totally identified with the emotions. We become overwhelmed by them. We tend to fall into patterns of reactivity, such as rumination and excessive worrying and catastrophic thinking. That any kind of reactivity like that simply has the effect of reinforcing the underlying anxiety or depression. We must change our relationship to our emotions so that we have a relationship that is not reactive and where we do not become blindly identified with those emotions. We learn instead to develop a conscious presence with our emotions in which we are the observer. This is very important. So training to be the observer in itself begins to change the whole impact of that emotional reactivity on you. Because the more that you can become the observer, the less you will be feeding the anxiety or depression through reactivity. So being the conscious observer is a primary training that I will teach you during our Skype therapy sessions together. I will teach you how to do this. The main mechanism that we use to develop this skill of objective consciousness is to learn how to meditate on your emotions. We do not use meditation to escape our emotional pain or to try and create some idealized world in which there is no emotional pain. Instead, we use mindfulness meditation to focus directly on those emotions. This is the primary function of mindfulness meditation. It is to heal emotional suffering, to see emotional pain directly, to form a non-reactive relationship with that emotional pain as the observer, and then to respond in a skillful and compassionate way to that emotion to help it heal. So we learn to see our emotions rather like children. We train to become the parent that can best respond to the needs of the child. We train to become the observer so we can best respond to the needs of the emotion that is in pain. And there are various ways we do this. The first thing, of course, is to break free from the blind habitual reactivity that feeds the anxiety or depression. So that's the first major achievement. And it's not that difficult to do. With skilled guidance, you can develop that objective consciousness and sit with your emotional pain without becoming consumed by it within a few sessions. It doesn't take that long. It's really more about understanding the process that feeds emotional pain, the process that sustains anxiety and depression. So that's the first part of mindfulness therapy. The second part is the response of compassion, that is learning how to help those emotions heal. And this very often involves the use of imagery, because the fact is that all emotions are based around psychological imagery. The way you see the emotion in the mind is what really determines that emotion. But that imagery, just like the emotion itself, is basically habitual in nature. So in mindfulness therapy, of course, we are training to become more conscious as the observer, and we can see this anxiety-based imagery more clearly when we stop reacting. Then we can help that imagery change. And when the imagery changes, the emotion heals. So that's a fundamental part of mindfulness therapy and mindfulness meditation in general. It's about looking at the structure of your emotions and then responding in a way that helps them heal. This is mindfulness meditation as taught by the Buddha, and it works extremely well when put into practice. So if you'd like to learn more about this approach, do please contact me and we can schedule a few Skype therapy sessions so you can see for yourself how effective this mindfulness-based approach can be for healing anxiety and depression and other forms of emotional suffering. Thank you.